So therefore, our facial nerve will travel through 3 different segments in the facial canal, which I am going to draw right now. The 3 different segments will be, please draw alongside with me, these 3 segments will be, for example, the first component will be passing laterally. This is the lateral component, the first segment of the facial nerve, laterally. It will pass laterally, simply laterally over the vestibular area. Then it will produce acute turn. There will be an acute turn. Here, this is an acute turn with a convexity, and this convexity will have a bulging, and this bulging is called genu. So it will produce an acute turn, and then it will travel laterally. It will travel laterally, horizontally, and behind. It will travel behind, that is posteriorly. Where it will travel posteriorly, it will travel just above one structure which I am going to draw, and this structure, violet color, I am going to draw it as promontory. Now this promontory, which is present in the middle ear cavity, it will serve as the medial wall of middle ear cavity. Simply write it as promontory. Medial wall of middle ear cavity. Again, this will be clear when we discuss the middle ear cavity. So the second channel, second component, first segment of the facial nerve within the facial canal will be, it is traveling laterally above the vestibular area. Second will be, it will take a turn. As it takes a turn, there will be a concavity which is known as the genu. This will be known as the genu. And here, there will be presence of one ganglion, which I will come to back later on, which is known as geniculate ganglion. Geniculate ganglion. Second turn will be posteriorly, it will go posteriorly directed just above the promontory. Where? On the medial wall, just above the medial wall of middle ear cavity. Above the medial wall of middle ear cavity. And the third component will be, again another turn will be there, where it will turn down vertically. It will pass vertically down. This is the third segment, third component. And this vertical segment will be posterior to promontory, just posterior to promontory, where it will exit through the foramen. And what should be the name of this foramen? Stylomastoid foramen. So third is the vertical segment. It is present behind the promontory. Actually speaking, it will be present just between promontory, behind the promontory, and in front of or below. If you draw this, this will serve as, here you draw this structure, it will serve as additus to mastoid. Simply draw this additus to mastoid. So this is an additus, a channel going to the mastoid antrum, additus to mastoid, which will be clear during the discussion of middle ear cavity. So the third component, vertical component, will pass vertically down behind promontory, in between promontory and additus to mastoid. And just behind the promontory, we have to draw green color segment, a very small triangular structure, which is called pyramid. You can draw this pyramid like this, and this pyramid will contain one muscle, which is known as stapedius. So the name of this muscle, here you can draw the orange color muscle. This will be known as stapedius. Name of this muscle, stapedius, S-T-A-P-E-D-I-U-S. So this is the entire course of facial nerve. Now we come to the branches, very important, branches of facial nerve. What are the branches of facial nerve? The branches of facial nerve will be, number one, first branch of facial nerve, when it is present in the facial canal at the level of genu, will be this branch. You can draw over here. This is the branch. Name of this branch will be greater petrosal nerve. So write it as greater petrosal nerve. Greater petrosal nerve. This is the first branch from the genu. Where does it go? It is a long course. Greater petrosal will pass through the hiatus of the greater petrosal groove, then it will pass and enter the foramen lesser round, where it will combine with deep petrosal nerve to form nerve to pterygoid canal, where it will pass through the pterygoid canal, it will relay in the pterygoperine ganglion, etc., etc. These details will be later part. Right now, in the facial nerve, just have to remember the name of the nerve, name of the branch. So, greater petrosal nerve, first branch, which will carry secretomotor parasympathetic fibers towards the pterygoperine ganglion from the genu. Second branch will be the nerve which is given to this muscle. Remember the name of this muscle? Stapedius. So this will be known as nerve to stapedius. So here we mark this as nerve to stapedius, nerve to stapedius muscle. So this nerve to stapedius will supply stapedius muscle. It is the smallest muscle present in our body. Very small. Stapedius muscle is present in middle ear cavity. Function of stapedius muscle to decrease the frequency of the sound, to decrease the amplitude of the sound. So therefore this nerve will supply stapedius muscle. It will decrease the vibrations of the ear ossicles during the transmission of the sound. And remember, if this nerve is damaged, then this muscle, stapedius muscle, will be paralyzed. Once it is paralyzed, then the person will even hear the normal sound in a large quantity, large amount. This type is known as hyperacusis. This kind of syndrome, this kind of condition is called hyperacusis. So the second branch is nerve to stapedius. Third branch will be, the third branch which I will draw will be, just draw it as very important, chorda tympani nerve. Chorda tympani nerve. C-H-O-R-D-A, chorda tympani nerve. Now this chorda tympani nerve, again it is a long course like greater petrosal nerve. It will carry preganglionic fibers, it will carry directly to the submandibular sublingual glands, also it will carry test fibers to the anterior two-third of tongue, etc. etc. Just remember the name here, chorda tympani nerve. So number 1, greater petrosal nerve. Number 2, nerve to stapedius. Number 3, chorda tympani nerve. This chorda tympani nerve will pass through the middle ear cavity, it will pass outside the skull through petrotympanic fissure. 3 branches which are given above the stylomastoid foramen before the facial nerve exits from stylomastoid foramen. So once again, my dear students, please remember the 3 branches, greater petrosal nerve, nerve to stapedius and chorda tympani will be present in facial canal. These are the branches given in the facial canal. Now another 3 branches as it exits from the facial canal. The branches which are given as it exits from the facial canal, that is stylomastoid foramen, as it passes outside the stylomastoid foramen, that is at the base of the skull, once it passes outside through stylomastoid foramen, the branches will be, number 1, here you can draw it in this line diagram, this branch, this will be known as the digastric branch, given to the posterior belly of digastric. Remember digastric, anterior belly and posterior belly. Anterior belly is supplied by a branch of mandibular nerve, posterior belly is supplied by this division of facial nerve. So digastric branch. Then there will be another branch which will be given, which will be known as a larger branch, posterior auricular. So therefore I will write here this as digastric. This I will write it here as posterior auricular branch. This posterior auricular branch will supply auricularis posterior muscle and occipitalis muscle. Remember, auricularis posterior and occipitalis muscle, posterior auricular. And the third branch which will be given will be known as stylohyoid branch. This is the branch given to the stylohyoid muscle. So therefore, 3 branches after the facial nerve will exit from stylomastoid foramen. Number 1, digastric, then posterior auricular and stylohyoid branch. So 3 branches given before it exits, when it is present in the facial canal, greater auricular, then greater petrosal, then there will be nerve to stapedius and chorda tympani. 3 more branches once it is given after exiting from stylomastoid foramen. Digastric, posterior auricular, stylohyoid. And then after giving these 3 branches, it will enter, this nerve will enter the parotid gland. After entering the parotid gland, it will divide into 5 branches. And these 5 branches which will exit, which we have already discussed, will be temporal, zygomatic, upper buccal, lower buccal, marginal mandibular and cervical. Here we have to remember the individual distribution of these branches to the facial muscles, my dear students. Remember, I will tell you one